Chapter 6, the Skeletal System.
If you can't fly, run. If you can't run, walk. If you can't walk, crawl. But by all means, keep moving.
Go, skeletal system. Imagine for a moment that people did not have skeletons. What comes to mind? Probably that each of us would be a little heap on the floor, much like a jellyfish out of water. Such an image is accurate and reflects the most obvious functions of the skeleton to support the body. Although it is a framework for the body, the skeleton is not at all like the wooden beams that support a house. Bones are living organs that actively contribute to the maintenance of the internal environment of the body. The skeletal system consists of bones and other structures that make up joints of skeleton. The type of tissue present are bone tissue, cartilage, and fibrous connective tissue that forms the ligaments that connect the bone to bone. Functions of the skeleton. 1. Provides a framework that supports the body. The muscles that are attached to bones move the skeleton. 2. Protects some internal organs from mechanical injury. The rib cage protects the heart and lungs, for example. 3. Contains and protects the rib bone marrow, the primary hematopoietic, in parentheses, blood forming, close parentheses, tissue. 4. Provides a storage site for excess calcium. Calcium may be removed from bone to maintain a normal blood calcium level, which is essential for blood clotting and proper functioning of muscles and nerves. Types of bone tissue. Bone was described as tissue in Chapter 4. Recall that bone cells are called osteocytes, and the matrix of bone is made of calcium salts and collagen. The calcium salts are calcium carbonate, CaCO3. The calcium phosphate, Ca3, in parentheses, PO4, close parentheses, 2, close parentheses, which give bone the strength required to perform its supportive and protective functions. Bone matrix is non-living, but it changes constantly, with calcium that is taken from bone into the blood replaced by calcium from the diet. In normal circumstances, the amount of calcium that is removed is replaced by an equal amount of calcium deposited. This is the function of osteocytes. The primary cilia of osteocytes detect changes in the calcium content of the tissue fluid that surrounds them, which enables the cells to regulate the amount of calcium that is deposited in or removed from the bone matrix. In bone, as in organ, 2 types of bone tissue are present. Compact bone looks solid but is very precisely structured. Compact bone is made of osteons or Haversian systems, microscopic cylinders of bone matrix with osteocytes in concentric rings around central Haversian canals. You can see that the osteocytes look somewhat like spiders, with the legs of adjacent spiders in contact. These legs are cytoplasmic extensions of osteocytes through microscopic canaliculi, or little canals, in the matrix. In the Haversian canals are blood vessels. The innermost osteocytes are in contact with these blood vessels and receive nutrients and oxygen. These useful materials are then passed to the osteocytes in the outer rings. The second type of bone tissue is spongy bone, which does look rather like a sponge with its visible holes or cavities. Osteocytes, matrix, and blood vessels are present but are not arranged in Haversian systems. The cavities in spongy bone often contain red bone marrow, which produces red blood cells, platelets, and the 5 kinds of white blood cells. Classification of bones. 1. Long bones. The bones of the arms, legs, hands, and feet, but not the wrists and ankles. The shaft of a long bone is the diaphysis, and the ends are called epiphysis. The diaphysis is made of compact bone and is hollow, forming a canal within the shaft. This marrow canal or medullary cavity contains yellow bone marrow, which is mostly adipose tissue. The epiphyses are made of spongy, bony covered with a thin layer of compact bone. Although red bone marrow is present in the epiphyses of children's bones, it is largely replaced by yellow bone marrow in adult bones. 2. Short bones, the bones of the wrists and ankles. 3. Flat bones, the ribs, shoulder blades, hip bones, and cranial bones. 4. Irregular bones, the vertebrae and facial bones. Short, flat, and irregular bones are made of spongy bone covered with a thin layer of compact bone. Red bone marrow is found within the spongy bone. The joint surfaces of bones are covered with articular cartilage, which provides a smooth surface. Covering the rest of the bone is the periosteum, a fibrous connective tissue membrane whose collagen fibers merge with those of the tendons and ligaments that are attached to the bone. The periosteum anchors these structures and contains both the blood vessels that enter the bone itself and osteoblasts that will become active if the bone is damaged. Takeaways. 1. Describe a long bone such as the humerus in terms of the tissues of which it is made. 2. Describe a flat bone such as the sternum in terms of tissues of which it is made. 3. Describe the matrix of bone tissue. Embryonic growth of bone. During embryonic development, the skeleton is first made of cartilage and fibrous connective tissue, which are gradually replaced by bone. Bone matrix is produced by cells called osteoblast. In parentheses, a blast cell is a growing or producing cell, and osteo means bone. Close parentheses. In the embryonic model of the skeleton, osteoblasts differentiate from the fibroblasts that are present. The production of bone matrix called ossification begins in a center of ossification in each bone. The cranial and facial bones are first made of fibrous connective tissue in the 3rd month of fetal development. Fibroblasts, in parentheses, spindle-shaped connective tissue cells, become more specialized and differentiate into osteoblasts, which produce bone matrix from each center of ossification. Bone growth radiates outward as calcium salts are deposited in collagen of the model of the bone. This process is not complete at birth. A baby has areas of fibrous connective tissue remaining between the bones of the skull. These are called fontanelles or fontanelles, which permit compression of the baby's head during birth while breaking the still thin cranial bones. The fontanelles also permit the growth of the brain after birth. You may have heard fontanelles referred to as soft spots, and indeed they are. A baby's skull is quite fragile and must be protected from trauma. By the age of 2 years, all of the fontanelles have become ossified, and the skull becomes a more effective protective covering for the brain. The rest of the embryonic skeleton is first made of cartilage, and ossification begins in the 3rd month of gestation in the long bones. Osteoblasts produce bone matrix in the center of the diaphyses of the long bones and in the center of short, flat, and irregular bones. Bone matrix gradually replaces the original cartilage. The long bones also develop centers of ossification in their epiphyses. At birth, ossification is not yet complete and continues throughout childhood. In long bones, growth occurs at the epiphyseal disc. At the junction of the diaphyses, at each epiphysis, an epiphyseal disc is still cartilage, and the bone growth in length as more cartilage is produced on the epiphyses side. On the diaphyses side, osteoblasts produce bone matrix to replace the cartilage. Some osteoblasts become surrounded by bone and settle down to become maintenance cells and osteocytes. As long as cartilage is produced, some osteoblasts will follow and replace the cartilage. Between the ages of 16 and 25, in parentheses, influenced by estrogen or testosterone, close parentheses, cartilage production slows, bone replacement catches up, and all of the cartilage matrix of the epiphyseal disc is replaced by bone matrix. This is called closure of the epiphyseal disc, in parentheses, or we say the discs are closed, close parentheses, and the bone lengthening process stops. Also in bones, and shown in figure 6.3, are the specialized cells called osteoclast. A clast cell is destroying cell, which are large cells with several nuclei and a ruffled skirt appearance. And osteoclast secretes acid and enzymes to dissolve and digest the microscopic bit of bone matrix, and then absorbs the minerals and amino acids. This process is called resorption. Osteoclasts are very active in embryonic long bones, and they reabsorb bone matrix in the center of the diaphysis to form the marrow canal. Blood vessels grow into marrow canals of embryonic long bones, and red bone marrow is established. After birth, the red bone marrow is replaced by yellow bone marrow. Red bone marrow remains in the spongy bone of short, flat, and irregular bones. Bone tissue and bones are organs. Bone tissue and bones as organs are never really finished. Throughout life, bone matrix undergoes a process called remodeling. Calcium is removed by osteoclasts to raise the blood calcium level, or calcium salts are made and deposited by osteoblasts to lower the blood calcium level. These cells also respond to environmental factors such as the body's bearing extra weight for the functions of osteoclasts and osteoblasts following bone injury. See box 6.1, fractures and their repair. Takeaways 2. 1. Describe the function of osteoblasts and osteoclasts and the purpose of these functions. 2. Besides size, how is the skull of a 6-week-old infant different from that of a 6-year-old child, and why? 3. In growing long bones, where does growth occur? What tissues are produced to accomplish growth? Factors that affect bone growth and maintenance. 1. Heredity. Each person has a genetic potential for height, that is, a maximum height, with genes inherited from both parents. Many genes are involved and their interactions are not well understood. Some of these genes are probably those for the enzymes involved in cartilage and bone production, because this is how bone grows. 2. Nutrition. Nutrients are the raw materials of which bones are made. Calcium, phosphorus, and protein become part of the bone matrix itself. Vitamin D is needed for the efficient absorption of calcium and phosphorus by the small intestine. Vitamin D deficiency in small children causes rickets. Bones are soft and weight-bearing bones often bend. Vitamin A and C do not become part of bone but are necessary for the process of bone matrix formation, ossification or calcification, in parentheses, close parentheses. Without these and other nutrients, bones cannot grow properly. Children who are malnourished grow very slowly and may not reach their genetic potential for height. 3. Hormones. Endocrine glands produce hormones that stimulate specific effects in certain cells, and they will be covered as a whole in Chapter 10. For now, we will say that several hormones make important contributions to bone growth and maintenance. These include growth hormone, thyroxine, parathyroid hormone, and insulin, which help regulate cell division, protein synthesis, calcium metabolism, and energy production. The sex hormones estrogen or testosterone help bring about the cessation of bone growth. The hormones and their specific functions are listed in Table 6.1. Note, this table contains more detailed information about the effects of hormones on bone. Your instructor will tell you how much of this table you will be responsible for learning. Don't hesitate to ask for assistance. 4. Chemical communication from other tissues. As mentioned in Chapter 4, adipose tissue produces leptin that stimulates osteoblasts to produce bone matrix. The body's energy storage tissue communicates with the body's weight-bearing tissue. Bone tissue communicates in return. Osteoblasts produce a protein called osteocalcin, which decreases fat storage by adipose tissue and increases insulin production by the pancreas. Both of these responses are believed to help the body maintain a normal weight. The small intestine also communicates with bone tissue. Cells in the small intestine produce serotonin, in parentheses, gut serotonin, close parentheses. You may have heard of serotonin as a CNS neurotransmitter that affects mood, in parentheses, brain serotonin, close parentheses. Gut serotonin is much more abundant than brain serotonin, but gut serotonin does not affect the brain. It does, however, inhibit osteoblasts from producing bone matrix, the opposite of the effect of leptin. We have much more to learn, but for now we can say that bone tissue is also influenced by the organ most responsible for absorption of nutrients, the small intestine. 5. Exercise or stress. For bones, exercise means bearing weight, which is just what bones are specialized to do. Without this stress, which is normal and necessary, bones will lose calcium faster than it is replaced. Exercise need not be strenuous. It can be as simple as the walking involved in everyday activities. Strenuous exercise that includes bearing more than the body's own weight will remodel bones. They will become thicker and stronger as more matrix is deposited, given sufficient calcium and phosphorus in the diet. But bones that do not get even minimal exercise, such as those of patients confined to bed, will be remodeled as well, but they will lose matrix and become thinner and more fragile. This condition is discussed further in Box 6.2, osteoporosis. Takeaways 3. 1. Name 2 nutrients that are important for bone growth but do not actually become part of bone. 2. Name 2 nutrients that do become part of bone. 3. What does exercise for bone mean, and what is the response of bone tissue to this kind of exercise? The skeleton. The human skeleton has 2 divisions, the axial skeleton, which forms the axis of the body, and the appendicular skeleton, which supports the appendages or limbs. The axial skeleton consists of the skull, vertebral column, and rib cage. The bones of the arms and legs and the shoulder and pelvic girdle make up the appendicular skeleton. Many bones are connected to other bones across joints by ligaments, which are strong cords or sheets of fibrous connective tissue. The importance of ligaments become readily apparent when a joint is sprained. A sprain is a stretching or even tearing of the ligaments of a joint, and though the bones are not broken, the joint is weak and unsteady. We do not often think of our ligaments, but they are necessary to keep our bones in the proper positions to keep us upright or to bear weight. The body has 206 bones in total. The complete skeleton is shown in Figure 6.4. Skull. The skull consists of 8 cranial bones and 14 facial bones. Also in the head are 3 small bones in each middle ear cavity and the hyoid bone that supports the base of the tongue. The cranial bones from the brain case, in parentheses, line with the meninges, close parentheses, that encloses and protects the brain, eyes, and ears. The names of some of these bones will be familiar to you. They are the same as the terminology used to describe areas of the head. These are the frontal bone, parietal bones, 2, in parentheses, temporal bones, 2, and occipital bone. The sphenoid bone and the ethmoid bone are part of the floor of the brain case, and the orbits, in parentheses, sockets for the eyes, The frontal bone forms the forehead and the anterior part of the top of the skull. Parietal means wall, and the two large parietal bones form the posterior top and much of the side walls of the skull. Each temporal bone on the side of the skull contains an external auditory meatus, in parentheses, ear canal, close parentheses, a middle ear cavity, and an inner ear labyrinth. The occipital bone forms the lower posterior part of the brain case. Its foramen magnum is a large opening for the spinal cord, and the two condyles, in parentheses, rounded projections, close parentheses, on either side articulate with the atlas. The first cervical vertebrae, the synovial bone, is said to be shaped like a bat, and the greater wing is visible on the side of the skull between the frontal and temporal bones. The body of the bat has a depression called the sella tertia or the sella turca, which encloses the pituitary gland. The ethmoid bone has a vertical projection called the crista galli, in parentheses, rooster's comb, close parentheses, that anchors the cranial meninges. The rest of the ethmoid bone forms the roof and upper walls of the nasal cavity, and its perpendicular plate forms the upper part of the nasal septum. All of the joints between cranial bones are immovable joints called sutures. It may seem strange to refer to a joint without movement, but the term joint or articulation is used for any junction of two bones. In parentheses, the classification of joints will be covered later in this chapter, close parentheses. In a suture, the serrated or sawtooth edges of adjacent bones fit into each other. Their interlocking projections prevent sliding or shifting of the bones if the skull is subjected to a blow or pressure. In figure 6.5, you can see the coronal suture between the frontal and parietal bones, the squamosal suture between the parietal and temporal bones, and the lambdoidal suture between the occipital and parietal bones. Not visible is the sagittal suture, where the two parietal bones articulate along the midline of the top of the skull. All of the bones of the skull, as well as the large sutures, are shown in figures 6.5 through 6.8. Their anatomically important parts are described in table 6.2. On the 14 facial bones, only the mandible, lower jaw, is movable. It forms a condyloid joint with each temporal bone. The other joints between facial bones are all sutures. The maxilla are the two upper jaw bones, which also form the anterior portion of the hard plate, in parentheses, root of the mouth, close parentheses. Sockets for the roots of the teeth are found in the maxilla and the mandible. The two nasal bones form the bridge of the nose, where they articulate with the frontal bone, in parentheses. The rest of the nose is supported by cartilage, close parentheses. There is a lacrimal bone at the medial side of each orbit. The lacrimal canal contains the lacrimal sac, a passageway for tears. Each of the two zygomatic bones forms the point of a cheek and articulates with the maxilla, frontal bone, and temporal bone. The two palatine bones are the posterior portion of the hard palate. The plow-shaped vomer forms the lower part of the nasal septum. It articulates with the perpendicular plate of the ethmoid bone. On either side of the vomer are the conchae, 6 scroll-like bones that curl downward from the sides of the nasal cavity. They help increase the surface area of the nasal mucosa. These facial bones are included in table 6.2. Paranasal sinuses are air cavities located in the maxilla and frontal syphenoid and ethmoid bones. As the name paranasal suggests, they open into the nasal cavities and are lined with ciliated epithelium. Continuous with the mucosa of the nasal cavities, we are aware of our sinuses only when they become stuffed up, which means that the mucus they produce cannot drain into the nasal cavities. This may happen during upper respiratory infections such as colds or with allergies such as hay fever. These sinuses, however, do have functions. They make the skull lighter in weight because air is lighter than bone, and they provide resonance for the voice, meaning more air to vibrate and thus deepen the pitch of the voice. The mastoid sinuses are air cavities in the mastoid process of each temporal bone. They open into the middle ear. Before the availability of antibiotics, middle ear infections often cause mastoiditis, infection of the sinuses. Within each middle ear cavity are three auditory bones, the malleus, incus, and stapes. As part of the hearing process, these bones transmit vibrations from the eardrum to the receptors in the ear. The vertebral column, in parentheses, spinal column or backbone, is made of individual bones called vertebrae. The names of vertebrae indicate their location along the length of the spinal column. There are 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral, fused into 1 sacrum, and 4 to 5 small coccygeal vertebrae fused into 1 cossack. The 7 cervical vertebrae are those within the neck. The first vertebrae is called the atlas, which articulates with the occipital bone to support the skull and forms a pivot joint with the odontoid process of the axis. The second cervical vertebrae. This pivot joint allows us to turn our heads from side to side. The remaining 5 cervical vertebrae do not have individual names. The thoracic vertebrae articulate, in parentheses, form joints, close parentheses, with the ribs on the posterior side of the trunk. The lumbar vertebrae, the largest and strongest bones of the spine, are found in the small of the back. The sacrum permits the articulation of the 2 hip bones. The sacroiliac joints. The coccyx is the remnant of the tail vertebrae and some muscles of the perineum, in parentheses, pelvic floor, and anchored to it. All are anchored to it. All of the vertebrae articulate with one another in sequence, connected by ligaments to form a flexible backbone that supports the trunk and head. They also form the vertebral canal, a continuous tunnel, in parentheses, lined with the meninges, close parentheses, that contains the spinal cord and protects it from mechanical injury. The spinous and transverse processes are projections for the attachment of the muscles that bend the vertebral column. The facets of some vertebrae are small, flat surfaces for articulation with other bones, such as the ribs with the facets of the thoracic vertebrae. The supporting part of a vertebrae is its body. The bodies of adjacent vertebrae are supported by discs of fibrous cartilage. These discs cushion and absorb shock and permit some movement between vertebrae, in parentheses, symphysis joints, close parentheses. Because there are so many joints, the backbone as a whole is quite flexible. The normal spine in anatomic position has 4 natural curves, which are named after the vertebrae that form them. The rib cage, or refer to figure 610, and notice that the cervical curve is forward, the thoracic curve backward, the lumbar curve forward, and the sacral curve backward. These curves center the skull over the rest of the body, which enables a person to more easily walk upright. The rib cage consists of 12 pairs of ribs and the sternum of breastbone. The 3 parts of the sternum are the upper manubrium, the central body, and the lower xiphoid process. Notice that the manubrium articulates with the clavicles. All of the ribs articulate posteriorly with the thoracic vertebrae. The first 7 pairs of the rib are called true ribs. They articulate directly with the manubrium and body of the sternum by means of costal cartilages. The next 3 pairs are called false ribs. Their cartilage join the 7th rib cage. The last 2 pairs are called floating ribs because they do not articulate with the sternum at all. An obvious function of the rib cage is that it encloses and protects the heart and lungs. Keep in mind, though, that the rib cage also protects organs in the upper abdominal cavity, such as the liver and spleen. The other important function of the rib cage depends on its flexibility. The ribs are pulled upward and outward by the external intercostal muscles. This enlarges the chest cavity, which expands the lungs and contributes to inhalation. The shoulder and arm. The shoulder girdles attach the arms by the axial skeleton. Each consists of the scapula, shoulder blade, and clavicle, collarbone. The scapula is a large flat bone with several projections, in parentheses the spine of the scapula, the coracoid process, close parentheses, that anchor some of the muscles that move the upper arm and the forearm. A shallow depression called the glenoid fossa forms a ball and socket joint with the humerus, the bone of the upper arm. If you look at the posterior view of the skeleton, you will see that the scapulae do not articulate with the backbone, but seems to be resting on the rib cage. Each scapula is held in place by the rib cage by many muscles that are anchored to the backbone and to the humerus. The medial end of each clavicle articulates with the manubrium of the sternum. At the base of your neck, you can feel the space between the two clavicles. This is the interclavicle notch, also called the suprasternal notch. The lateral end of each clavicle articulates with the scapula on its own side. In their position between the scapulae and the sternum, the clavicles act as braces for the scapulae and prevent the shoulder from coming too far forward. Although the shoulder joint is capable of a wide range of movement, the shoulder itself must be relatively stable if these movements are to be effective. The humerus. The humerus is the long bone of the upper arm. In Figure 6.12, notice the deltoid tubercle or tuberosity. The triangular deltoid muscle that caps the shoulder joint is anchored here. Proximally, the head of the humerus forms a ball and socket joint with the scapula. Distally, the humerus forms a hinge joint with the ulna of the forearm. This hinge joint, the elbow, permits movement in one plane, that is, back and forth with no lateral movement. The forearm bones are the ulna on the little finger side and the radius on the thumb side. The semi-lunar notch of the ulna is part of the hinge joint of the elbow. It articulates with the trochlea of the humerus. The radius and the ulna articulate proximally to form a pivot joint, which permits turning the hand palm up to palm down. You can demonstrate this yourself by holding your arm palm up in front of you and noting that the radius and ulna are parallel to each other. Then turn your hand palm down and notice that your upper arm does not move. The radius crosses over the ulna, which permits the hand to perform a great variety of movements without moving the entire arm. The carpals are 8 small bones in the wrist, gliding joints, in parentheses also called planar joints, close parentheses. Between them permit a sliding movement. The carpals also articulate with the distal ends of the ulna and radius, and with the proximal ends of the metacarpals, the 5 bones of the palm of the hand. All of the joints formed by the carpals and metacarpals make the hand very flexible at the wrist. Try this yourself. Flexion to extension should be almost 180 degrees, but the thumb is more movable than the fingers because of its carpo-metacarpal joint. This is a saddle joint which enables the thumb to cross over the palm and permits gripping. The phalanges are the bones of the fingers. There are 2 phalanges in each thumb and 3 in each of the fingers. Between phalanges are hinge joints, which permit movement in one plane. Important parts of the shoulder and bones are described in Table 6.3. The hip and leg. The pelvic girdle, in parentheses, or pelvic bone, close parentheses, consists of 2 hip bones, coaxi or innominate bones, close parentheses, which articulate with the axial skeleton at the sacrum. The 2 sacroiliac joints are gliding joints, or planar joints, that permit a small amount of side-to-side movement. For women during pregnancy, increased secretion of the hormone estrogen by The placenta makes the ligaments of these joints more stretchable and the joints themselves slightly more movable. This helps facilitate childbirth. Each hip bone has three major parts: the ilium, ischium, and pubis, and these are shown in figure 613, which depicts both a male and female pelvis. The ilium is the flared upper portion that forms the sacroiliac joint. The ischium is the lower posterior part that we sit on. The pubis is the lower most anterior part. The two pubic bones articulate with one another at the pubic symphysis, with a disc of fibrous cartilage between them. Notice the public angle of both the male and female pelvises in 613. The wider female angle is an adaptation for childbirth in that it helps make the pelvic outlet larger. The pubic symphysis also becomes more flexible under the influence of increased estrogen during pregnancy. The acetabulum is the socket in the hip bone that forms a ball and socket joint with the femur. Compared with the glenoid fossa of the scapula, the acetabulum is a much deeper socket. This has great functional importance because the hip is not a weight-bearing joint, whereas the shoulder usually is not. Because the acetabulum is deep, the hip joint is not easily dislocated, even by activities such as running and jumping, in parentheses landing, close parentheses, which put great stress on the joint. The femur is the long bone of the thigh. As mentioned, the femur forms a very movable ball and socket joint with the hip bone. At the proximal end of the femur are the greater and lesser trochanters, large projections that are anchors for muscles. At its distal end, the femur forms a hinge joint, the knee with the tibia of the lower leg. Notice in 614 that each bone has condyles, which are the rounded projections that actually form the joint. The patella or kneecap is anterior to the knee joint, enclosed in the tendon of the quadriceps femoris, a large muscle group of the anterior thigh. The tibia is the weight-bearing bone of the lower leg. You can feel the tibia tuberosity, in parentheses, a bump, or close parentheses, and anterior crest, a ridge on the front of your own leg. The medial malleus, what we may call the inner ankle bone, is at the distal end. Notice in figure 614 that the fibula is not part of the knee joint and does not bear much weight. The lateral malleus of the fibula is the outer ankle bone you can find just above your foot. Though not a weight-bearing bone, the fibula is important in that leg muscles are attached and anchored to it, and it helps stabilize the ankle. Two bones on one is much more stable arrangement than one bone on one. And you can see that the malleoli of the tibia and fibula overlap the sides of the talus. The tibia and fibula do not form a pivot joint, as do the radius and ulna in the forearm. This also contributes to the stability of the lower leg and foot and the support of the entire body. The tarsals are the 7 bones in the ankle, as you would expect, and they are larger and stronger than the carpals of the wrist, and their gliding joints do not provide nearly as much movement. The largest is the calcaneus or heel bone. The talus transmit weight between the calcaneus and the tibia. Metatarsals are the 5 long bones of each foot, and phalanges are the bones of the toes. There are 2 phalanges in the big toe and 3 in each of the other toes. The phalanges of the toes form hinge joints with each other because there is no saddle joint in the foot. The big toe is not as movable as the thumb. The foot has 2 major arches, longitudinal and transverse, which are supported by ligaments. These are adaptations for walking completely upright, and the arches provide for spring or bounce in our steps. Important parts of hip and leg bones are described in Table 6.4. Takeaways 4. 1. What is the difference between a process and a meatus? What is the difference between a foramen and a fossa? 2. What are the 2 major structures found in the vertebral canal? 3. What bone in the leg has no counterpart in the arm? What bone in the leg has no counterpart in the arm? Moving right along. Joints, articulations. A joint is where two bones meet or articulate. The classification of joints. The classification of joints is based on the amount of movement possible. A synovial is an immovable joint, such as a suture between two cranial bones. An amphiarthrosis is a slightly movable joint, such as the symphysis joint between the adjacent vertebrae. A theirfunctions is a freely movable joint. This is the largest category of joints and includes the ball and socket joint, the pivot, hinge, and others. Examples of each type of joint are described in Table 6.5, and many of these are illustrated in Figure 6.15. Synovial joints. All theirfunctions or freely movable joints are synovial joints because they share similarities of structure. A typical synovial joint is shown in Figure 6.16. On the joint surface of each bone is the articular cartilage, which provides a smooth surface. The joint capsule, made of fibrous connective tissue, encloses the joint in a strong sheath like a sleeve. The capsule contributes to the stability of the joint. At the hip, for example, the joint capsules extend from the neck of the femur to the rim of the acetabulum and fit snugly like a tight sleeve. The joint capsules at the shoulder has a more loose fit, which permits the shoulder joint greater range of motion. Lining the joint capsule is the synovial membrane, which secretes synovial fluid into the joint cavity. Synovial fluid is thick and slippery and prevents friction as the bones move. Many synovial joints also have bursa or bursas, which are small sacs of synovial fluid between the joint and the tendons that cross over the joint. Bursae permit the tendons to slide easily as the bones are moved. If a joint is used excessively, the bursae may become inflamed and painful. The condition is called bursitis. Some other disorders of joints are described in Box 6.5. Arthritis. Takeaways. 5. 1. What type of joint is most numerous in the skull? Which joints in the skull are movable? 2. Describe how the joints of the arm and leg, in parentheses, not hand and foot, close parentheses, are similar. 3. Describe the location and function of the synovial membrane and synovial fluid. 4. What is the distinguishing physical characteristic of a symphysis joint? Aging and the skeletal system. With age, bone tissue tends to lose more calcium than is replaced. Bone matrix becomes thinner, the bones themselves become more brittle, and fractures are more likely to occur with mild trauma. Erosions of the articular cartilage of joints is also a common consequence of aging. Joints affected include weight-bearing joints such as the knees and active small joints such as those of the fingers. Although the normal wear and tear of joints cannot be prevented, elderly people can preserve their bone matrix with exercise, in parentheses, dancing counts, and diets high in calcium and vitamin D. Summary. Your knowledge of bones and joints will be useful in the next chapter as you learn the actions of the muscles that move the skeleton. It is important to remember, however, that bones have other functions as well. As a storage site for excess calcium, bones contribute to the maintenance of a normal blood calcium level. The red bone marrow found in flat and irregular bones produces the blood cells, red blood cells, with white blood cells and platelets. Some bones protect vital organs such as the brain, health, and lungs. As you can see, bones themselves may also be considered vital organs.